sister died here, and she almost died. And I think she wasn't into the weather, but that's just an observation.
You okay? You feel close?
I didn't want her to make lifelong friends, did you?
No.
People come and go, and I still have a job to do. Did you see anything? What's going on? Why won't her heart start?
The aortic aneurysm dissected and extended down, including the left coronary artery.
The blockage is keeping her heart from starting?
That's a massive infarction. We need to revascularize her coronary artery to restore blood flow, then put in an aortic graft. Let's prep for stenotomy.
You want to enter her first. The right. She did it in her foot before they can treat it.
The dissection was not for safe. Jackie's already been on it for hours. We need to move faster. Let's go. Dr. Shepard?
Whatever it is, it's gotta wait.
Yes, Dr. Adams. He wants you to know it's okay. Get us up to speed.
Single GFW to the right chest, no exit wound. He's hypoxic. He has a right hemothorax. His fast exam on his heart was negative. We need to prep for a chest tube.
Bullet fragments are localized in the right chest. Let's order a type and cross and trauma panel.
Can I do the chest tube?
Get her sterile gloves. His stats are dropping, so we need to move quickly. I bet when he walked out of the house with a gun today, he didn't expect to be the one getting shot. Ready? All right. You're going to make an incision between the fourth and fifth rib space. Now you're going to pop through the pleura. Now dilate by opening the clamp. Time for the tube. Keep going. All right, he's putting out a lot of blood. You need to call up to the OR.
Nice work, man. Her BP's 105 over 65.
That's good. How many weeks are you? 16 weeks. I had an appointment a week ago and everything looked fine.
HOB? I can.
No, you will not. You will get yourself checked. Dr. Warren?
Come on, you heard her. Let's go. I was just grazed. It can wait.
Do you think your colleague wants you to see me do her ultrasound? No. Go now. Don't let him out of your sight. Okay, Adams. Thank you.
Come on. Let's go.
Really, I need to see for myself. You are not your doctor, okay? On the page OB. In the meantime, all right, the placenta looks great. No eruption. And where is the? We have a strong heartbeat, right? What about the other one? There's another one? Okay, let me see. Oh, there it is. Oh, beautiful. Just these two, right? As far as I'm aware, yeah. You okay? No? Okay. All right, someone help me get her to speed. And where's Lincoln? We were finishing surgery.
It's just superficial abrasions, serious strips, and I'm good. Yeah, I got sight coming down for an eval. Yeah, I don't need that. In a whole hospital policy, you have to be cleared before you can go back to work.
I know it's important. You gotta process. Have you called your mom? Do you want me to call her?
Well, I really do not.
Oh, they just extubated Jackie.
Hey, go check on your patient, all right? There's already too many people standing around us there.
All right, you stay with him. Juan can cover post-op.
And I also have to go check on something.
What happened?
Wilson and I went to the convenience store to get ice. The guy tried to rob it. I got lucky. He's on his way up to the OR.
God, you're okay.
Griffith, I need you to help Millen transport this patient up to the OR.
That's. No, I can't. No.
Yeah, you can. It's just another patient.
Except he tried to shoot.
But he didn't.
It's just another patient.
I have to do a consult. Have him prep by the time I get up there. I want to do the service. It's all hands on deck. And he's got a problem with that. Frankly, I don't care.
So Dr. Marcus is on his way.
No, absolutely not. Literally anybody else.
Well, DeLuca is in Italy. Patel's on leave. Kincaid's in the OR. Isn't Dr. Marcus the chief OB resident?
It doesn't matter. She's not taking a trip down there.
Okay, I know it can be difficult keeping the patient with someone you usually work with, but you need somebody in.
I just heard what happened. Are you okay?
You're Marcus?
Yes, I finished med school. Undergrad only took me 2 years. It's Bailey, right? Wow, twins. It's a party. So it's likely stress that's causing the bleeding.
Okay. That's bad. She's also having acute back pain.
Wilson, next steps. Kidding. Pain and bleeding could also indicate other complications, so I'd like to. Okay, I was just getting the kids settled. I came as fast as I could.
It's okay.
Bleeding.
I'm feeling heaviness below.
I'd like to do a pelvic ultrasound. I'm assuming your dad.
So let's give them a minute.
No, you're right there.
Do you need a minute?
My son is throwing a tantrum and my ex wants me to calm him down. Tell me you have good news.
Well, your EKG is normal, but your white blood cell count is elevated, which means
I know what that means. Last time I needed surgery. Is that what's happening? Do I have to go through this all over again?
it could just be a mild infection or even stress or dehydration. Let's not worry until there's something to worry about. Okay?
Hey, what's happening? Just some chest pains and hopefully a disproportionate amount of anxiety.
Her EKG is normal, but she has leukocytosis and she's slightly febrile. We're still waiting on blood cultures.
All right, let's admit her, start her on broad spectrum antibiotics, get a chest x-ray and CT contrast. Is now a good time to worry? It's been such a day. You know, why don't you go with her? I can get Cass to come down and help out. It'll help with the scans going much quicker if you're there. All right?
Back when have it covered.
Yeah. Yes. No, I know. No, I do still love you. I just needed some space and like a minute away from school. I'll call you tomorrow.
Dave?
Yeah, he called like 8 times and I'd pick up. I didn't know what to say. You know, I didn't want him to know that I was here, so I just tried to pretend like everything was normal.
It's fine.
Anything but fine. I didn't make this through. They're slammed. I shouldn't have just showed up out of nowhere.
No, it's really okay.
At some point, I need to give Dave an answer. It's not his fault that this is what it is.
I don't really need to answer this, but I want a chance to talk about this. Hang out at my place, and we'll talk all about this tonight. If you need to go home, then go home.
I'll never understand how a person can point a loaded gun at a stranger. Well, people can hurt each other in all kinds of ways. Sure, it's killing is pseudo having a we don't. Sorry. I didn't mean to bring it up. When you want to talk about it, we will talk about it, and I won't be talking about it with you. Did I do something? I'm just pretending like we all mean something to each other. I get the intern here is hard and we're all trauma bonded or whatever, but we're just co-workers. I don't need you to comfort me or understand how I feel. I can take care of myself. I'm doing it my entire life.
How's it going in here?
Equipment. He's about to code. All right, Griffith, strap him in, Millen, prep him. You got the other side of the belt. Yeah, I got it.
Did anybody contact the blood bank to activate the MTV?
I'm not sure. I can check it. You are the intern on this case. You need to make sure that you are on top of the orders. Look right now. All right, he can't wait.
Okay, we need this going right now.
I was able to successfully clear the posterior aneurysm, but we ran into a complication when we tried to wean her off bypass. So what happened?
Check is stable, but she had an aortic dissection, which caused a heart attack.
My 17-year-old had a heart attack.
I opened her chest and I put in a graft, and thankfully she's an athlete, so her heart was able to recover from the MI.
I don't understand. Why do these complications keep happening?
Well, we knew her heart was at risk due to the root aneurysm.
My brain was a greater risk.
For post-op last week.
Dr. Kwan? How long does the anesthesia last? Hey, baby. You still feeling groggy? And my feet.
Your feet.
And my legs.
Dr. Kwan, would you get me a needle, please?
Yeah.
All right, Jackie, let me know when you start to feel this.
Did you start yet?
Whoa.
Why can't she feel her legs?
And I know she'll be the death of me. So broken.
People usually stand on the other side during a public exam to respect the area. Right. Sorry. I need you to relax, Wilson.
Okay.
You heard about Kincaid's uterine sarcoma case? Second reoccurrence. She's got 4 kids and a death sentence. You should see the scans. They're awful. Honestly, it's like a horror movie.
Puppies.
They're adorable and calming. I've been thinking about getting one for proof.
Your cervix is 18 millimeters.
So an imminent risk for preterm labor.
She's 16 weeks. She's 16 weeks.
Which is why I'd recommend a cervical cerclage. It's placing a suture around the cervix to keep it close.
He's a doctor.
Oh, hospital baby. So you're gonna name him Gray and Sloan? What are the risks of the cerclage?
Well, I could get an infection or it could cause damage to my cervix, like scarring or stenosis.
Other options, please?
This is the option besides terminating the pregnancy.
Cervical cerclage is very safe, and it is the absolute best way to preserve the health of octopus and babies right now. If you'd like, I could give you some time to think about it.
I go good consent form.
My 4-year-old listens better than you do.
Yeah, well, unless your toddler is also surging during a record-breaking heat wave, I don't think that's a fair comparison.
You shouldn't be seeing patients.
I'm still on schedule, and the ER is over capacity.
Okay, let me rephrase. I can't let you treat patients right now.
Fine. All right, I see life and death every single day. Business as usual.
You know, fine. If you want a job to do, why don't you head over to the clinic and help out at the cooling center?
Mrs. Long in bed 6 needs more stool softener.
Do you see anything?
Not yet. You championed me.
What?
You told Sky I could do this. You told me I could do this. I'm sitting here silently panicking about what I've done to this young woman, and you're hardly saying a word
You
to
don't
me.
think I'm panicking? You're not the only one who operated on her. I should have said no. And the second you brought me in, I had a bad feeling about it.
Why didn't you say anything?
You prematurely accepted the case. You knew it had a cardiothoracic component to it, but you accepted it before giving my opinion on it. She was admitted before I even saw her.
No, do not put this on me. You could have said no right after you walked out the door. Maybe you didn't because of how you treated her mother.
Nurse Connie said a cold front's coming in. The heat should break soon. At least there's that.
Scans are up. Quan, what do you see?
Head CT is negative for stroke.
What the CTA showed the dissection flap propagating into the descending aorta, which means
Blood flow to the spinal cord is compromised.
I think it's okay. Is the one?
Hey. Radiology's a little backed up. We'll get you in there as soon as we can.
you don't have to babysit me. Remember how annoyed you would get when your mom would make you watch me and Maggie when she went to the store?
Either that was a chore. This is
An excuse? You made that face earlier with Teddy.
what this.
I sense some tension. Sorry, you don't have to answer that. I think my surgical complications removed my filter, or maybe it was my divorce or down especially.
That's right. Marriage is complicated, but I can't let this happen any longer. Are you trying to go up or down?
I know. Damsel in distress. For myself. There.
Yeah.
Oh.
Where you going? She's ready for you, so I'll go find orderly.
Okay, good idea.
I will just first start you on progesterone and increase your monitoring.
Why can't you trust that I'm making the right decision? I'm a pregnant OBGYN. I want a cerclage. I'm getting a cerclage.
You can't just wave your specialty in front of my face every time we have a disagreement.
Hundreds of these. I do them all the time.
But you don't get them all the time. What about Marcus? How many has he done? Shouldn't we be waiting for somebody born before TikTok?
He's in for a year.
I have t-shirts older than him.
Okay, our heart rate's elevated. Maybe some deep breaths. I wish Dr. DeLuca was here. First of all, I would never have had Marcus's hands inside of me. And second of all, she would tell you how safe a cerclage is.
Maybe she could tell you that this isn't just your decision.
She would never tell me that.
Are you thinking clearly?
What?
You witnessed a shooting today. You could have been seriously hurt.
Okay, time out. Okay, you are now the one who is seriously hurting her. Her BP is 140 over 90, and that's too damn high for her and for me. Add to that 18 millimeter cervix, and you are tripling her chances for contractions. Take a walk.
Okay, I'm sorry. It's just
I am not asking. Look at me. In and out. Good. In, out. I've exposed the damaged tissue. He's gonna lose an entire lobe of his lung due to one bullet. GIA stapler, his bullet, he loaded into his lungs. You should invite the lawmakers voting against background checks to assist on these surgeries. Violent crime rises along with the temperature. With a story about a guy who drove his truck into a hardware store during a heat wave and killed 4 people.
Well, there's some bleeding at the staple line.
All right, 2 PDS. Thank you, both. Damn it. We can't get visualization suction. No. All right, Griffith, Millen, what do we do? Exactly. All right, team, you heard them. Anesthesia when you're ready. Oh my God, why is he moving? All right, stop.
Secure the line. Some orderlies.
Let's assess him and get him back on the table right now. Gently.
Let's keep him on amble until we get him back on the table. Where are those orderlies?
Damn it, his central line has come out. All right, shut off all the lines.
Got it.
Black sponge. All right, keep pressure on his IJ. Should we pack the thoracotomy? No. Here we go. All right, Millen, get me a wet towel.
Millen.
All right, take this. How the hell did this happen?
Must not have been completely strapped in.
And hold here. If your wife finds out, they're gonna fire me all over again. Keep applying pressure. Bring in the Annalise.
Come on, fellas.
We're gonna carefully lift him back on the table. Is everyone set? On my count. 1, 2, 3. I want to punch it in the spine.
we placed a small tube in Jackie's lower back to drain the excess fluid around her spinal cord.
There is a chance that it can reverse Jackie's paralysis. This morning, you assured us that you could take care of her aneurysms. You seemed so certain about it. That was before I saw the larger aneurysm. She is my only child. When did you know that this was going south? Was it when you had to open her skull? Or when you had to stop her heart? Or when you noticed there was something wrong with her spine? I need to know. I need to know. Did you ever think that you could save my child, or was I just a fool for believing it? I did think that I could save your child. And she is alive and aneurysm free. I do not make false promises because I have seen too many bad outcomes. This is not a bad outcome. Not yet. You trusted me once, trust me again. We have to act fast. Okay. I will trust you. Mostly because I don't have any other option.
I have finished.
Counters are
Oh, fiction, Lord
mosquitoes,
Jesus.
not so much. Off deep woods. Protection from mosquitoes and ticks. Prepare for the expected.
SC Johnson. All right, her BP is settled down. What do you think you're doing?
Celebrate.
Joe really doesn't want me in the room, neither do you, so I thought I'd help with an expert to know what right.
Well, you thought wrong.
What the hell am I supposed to think then? Ever since we found out it was twins, she shut me out. And I'm usually pretty good at carrying on, but today I can't.
When I was in labor with my son, his father was getting emergent brain surgery. Now, I initially didn't know about it because my OB never let it show on her face. She knew that I was at my most vulnerable. And she supported me with a strength that I will never forget. Joe has to do that on a daily basis. She treats those at their most vulnerable and stays calm. Right? They could be bending, toward she stays strong and encouraging because that's her job. But today, it should be yours. She's terrified. So pull yourself together so she can fall apart.
The central lines back in. There's no signs of bleeding or expanded hematoma.
Well, there's some bleeding from the intercostals, probably from the fall. Silk, I gave you specific instructions to strap the patient in on the table. Let me finish. Your mistake was extremely dangerous and completely unacceptable. We give our patients the very best care that we are capable of giving, no matter who the patient is or what he has done. And if we can't, then we leave before our personal distractions kill someone. I should kick you out of this OR, but instead I'm going to make you stand there and watch these repairs, which shouldn't even be happening in the first place. Am I clear?
Yeah, once the temperature started to drop, people started leaving. Do you know where the fans go?
It worked you longer than me.
Well, so you don't know where they keep the extra ice packs?
Just pack it up. Someone will figure it out.
Oh, don't ask her to be you.
Okay. Come here. Yeah, stay seated. Seated. Hey, feel the ground under your feet? Do you feel the ground under your feet? Good. Good. Just keep looking at me. Keep looking at me right here. You're in the clinic. You're not alone. You're safe. You are safe. And just breathe.
I just came down to say a prayer and you can't get the words out.
Dear Heavenly Father.
Yeah, Jackie's always been so full of life. You seeing her in that bed it just breaks my heart.
She's strong and resilient. Whatever happens, she'll keep kicking ass and taking names. There's no doubt in my mind.
I'm not a very observant Jew, but I've always been so moved watching people stand during services and give a Misha Barak for their loved ones. It's the prayer for healing. It's a mouthful, I know.
Sounds beautiful.
Misha Barak, Avotenu, Abraham, Yitzchak, Yaakov, Imotenu, Sarah.
You okay?
Can't feel a thing, so no.
Well, we change that.
I haven't been to insert the drain. Well, I'm scared that this is gonna make things worse. She tries to act all cool around me, but deep down, I know she worries.
Are you scared?
Not really. I was scared at first when I got diagnosed, but now, I don't know. I feel like if I think too much about it, I'll be too scared to do anything. Kind of like what coach says about overthinking free throws. Just gotta shoot your shot.
All right, the drain is in. I'll let you rest and I will check back in a bit.
Cool. If I'm not here when you get back, it's because it worked, and I walked away.
There you go.
Sorry, that was embarrassing.
No apologies necessary.
Yeah, I'm not really, feeling scared.
Yeah, no kidding.
I can't tell if I'm enraged or sad or.
I don't know how I want to do this section. Like, do I want to start from the bottom and then work my way up?
No, we get
No.
started.
Just making sure I'm doing what I feel ready.
All right.
It means part. And then
Work.
this and
Really? Yeah. Panic attack, not a heart attack. But I tell you what, I'll figure out where all this stuff goes, so you don't have to. Thank you.
Is that for good behavior or for you to soften the blow for whatever you're about to tell me?
Your scans are reassuring. The stent is not infected.
Oh my God, that's. Thank you.
White count is still elevated, so we want to keep you in for a few more doses of the antibiotics, if that's okay with you.
Yeah, of course. Why do I think there's more you want to tell me?
I don't think I should be on your care team anymore.
I'm sorry, the freshman me resurfaced, or at least the part that had a crush on her friend's older brother. I shouldn't have tried to kiss you.
It's not only you.
Oh,
Yeah. So, I'll have Timmy check in on you.
I'm just going to check his vitals. I'll be quick. He's a good guy. He just is going through some stuff. We both lost our jobs, and then his friend Eddie got sick, and then he just shut down. He stopped hanging out with his friends and stopped talking to me. I don't know why he thinks he needs to do it alone. Well, let's hope this is a wake-up call. I'll be back in the morning. You should get some rest. I'm getting the cerclage.
I'm sorry. It's just a couple of hours ago I found out you were involved in a shooting. 10 minutes later, I'm hearing imminent labor. You know, our whole world was in danger, and I freaked out. I just want to do whatever will keep you safe, whatever keeps them safe. That means Marcus and cerclage. If I have to get a cerclage, say cerclage. I'm not gonna. It's gross, but I just want to be here for you. For now. Just tell me what you need.
keep Marcus from talking during the procedure.
Okay. So, are you ready for this? You play tennis. I'll have your own built-in game McDonald's now. Marcus, I'm gonna need you to keep all chatter to medically relevant information.
How does the drain look?
It's draining.
How you feeling?
Same as when you last checked. I'd say they're my WNBA dreams, but those were already in the trash.
I'm guessing you'll have new dreams to chase.
Maybe, but basketball will always be my true love. There's got to be a way to keep it in my life.
Jackie, your toes are moving.
Fair. Oh my god, they are. Mom, look, it's working. The drain's working. 2 1-hour neuro checks. This is good. God. Update me on her progress.
You're gonna keep coming, aren't you? Impossible cases.
I'm never going to be able to look somebody in the eye and tell them I'm not going to try to help them. But if that's a problem for you,
No, I'm not scared of a challenge, Amelia. I mean, I take in the miracle. I always have. But what you did today was reckless. I don't do reckless. So if you need a miracle, okay, give me all the information up front, or find another surgeon.
hey, how you feeling? Circulage went well. No complications. Babies are still inside, so I'll take it. But I'll need to take a few days off.
Yes, you do.
Hey, thank you for staying with me. It really meant a lot with Link and Marcus. Oh God, Marcus, I can't stop picturing him between my legs. I'm not to quit.
He saved your babies. Just think about that. Get some rest.
Sitter's all set. What are you doing? You hungry? I get you some food.
I've been making decisions on my own my whole life, and being in a functional relationship and allowing someone else to weigh in on everything. I'm still.
And Gary and Fanny.
Is that your BP?
Yeah.
I get you juice.
Take orange juice. Thank you. Dr. Weber?
Melanie, okay?
It was me. I didn't strap Damien to the table. I thought I did, but I must have gotten distracted, and then when Dr. Altman called Griffith out, I froze. I should have taken responsibility for it then, and I didn't, so I am taking responsibility for it now. I'm sorry.
I appreciate that. But I'm not the one who needs an apology.
Hey, easy on that arm.
A little more in your spice on her.
Are you? Okay. I wasn't sure if this might have brought up some memories for you.
Yeah, a few. That day shaped my whole life. Probably Derek's too. You were his favorite, you know. He always saw something in you.
Oh, hey, you did it?
I found you infuriating. But it's kept my love animal around. You coming home tonight? That's okay. I'll see you tomorrow.
Hey, Chief, you got a minute?
No, but you're already here.
It's, about today. I'm sorry. I was only trying to help. You said that the hospital doesn't have emergency plans for heat domes. Turns out that we don't have ones for wildfires, tsunamis, and a few other natural disasters, and they're only increasing with climate change. So I want to put together a committee to fill in the gaps, with your permission, of course.
Permission not granted.
That's why not.
As much as you can't seem to grasp this, you are a resident on a trial basis. You have no business devising protocols that you can't follow. If I were you, I would spend less time assuming that you have a permanent position here and more time proving that you should have one. We're done here, Dr. Warren.
Really?
A t-shirt fell off the OR table. Oh, yeah. Do you mind getting the kids?
Could you check in on Nora Young before you leave?
Yeah, of course. After all these years, she still gets under your skin, doesn't she?
Yeah, I guess she does.
What happens in our brains in the moments before we die has puzzled scientists for centuries. While we have some evidence of her lives flashing before our eyes, there are still many questions.
Temperature dropped 21 degrees in 2 hours. How's Adams?
Well, he's okay. He's okay.
I'm used to seeing patients come off rigs every day, hundreds of them, some worse than others, but I can handle it, always have. If one more resident comes off a rig, I don't think I can. You talk to Altman?
Not yet.
No one knows exactly why it happens. Some people think it's biology, others believe it's spiritual.
So,
Okay.
there are people around.
It's been a long day. What we know for sure is that you can try to look away, pushing down all the uncertainty and pain. You and me. It feels like such a long shot. I mean, you're here. And I'm in California, and it's already so messy.
I'm overthinking.
I have to sort of think it.
Let me think about this. I've never stopped loving you. If that's enough. I'll say no to Dave. Turn down his proposal. Look, I don't want to get this wrong. If you and I start something without breaking it off with him, it'll feel wrong. So go home. Tell him. When we come back, I am never losing you again. So say no.
But your life will catch up with you in the end.
She didn't know where the road would lead. But the moment she stepped in, life changed. She now had all the power and space needed to live a life I might marry.
Seriously?
The all-new Audi Q3, made with a life of yes.
Before they're even scheduled for surgery, every patient asks how long it will take to recover. The implication being, the quicker the better.
Fancy car or the private jet. It's a nice way to distract from the X Factor being flown in for an FOC. That's a friend of Catherine.
Her friends deserve liver transplants too.
So we're doing that in Paris?
I missed the OR.
And this has nothing to do with LSE school fundraiser tonight?
I spend all my time fundraising for Alzheimer's research. It's 100% of my focus, and I can donate to the school or not.
Okay, I get it. You're scared of the demands, aren't you?
They're scared of me. Plus, this gives me a chance to pass the truth.
And Richard? How are you?
Search online, and you'll find advice from all kinds of people without medical degrees about how to heal faster.
Funny.
Into retreat morning.
Yeah, the whole day out of the OR. Why do you say nothing important?
What is miserable?
Interns all day.
Still avoiding Millie, huh?
She threw you under the bus with Altman. Has barely acknowledged Mason.
It's kind of hard to do that when you're avoiding her.
Whose side are you on? What are we supposed to wear to this thing?
Clothes? But do you have to put on right now?
Because most people don't want to hear what we say, which is to rest and let your body heal on its own time.
Oh, this is great.
Well, it's not Cottonwood Resort, but you know, you gotta do what you gotta do.
Oh, I loved when Richard would invite my residency class to his home.
Well, part of your meal, but you know, retreat is supposed to be a change of pace.
This has changed. You rearranged the whole living room. I hope this is fun. They need it.
I gotta go. Auburn's been watching me like a hawk ever since the heat dome.
You should be happy that's all she's doing.
What I'm just staying out of.
I'll see you tonight.
Good luck with your retreat.
Oh, no luck needed. Danny Ford, retreat facilitator. I've got a curriculum that's worked with clients from Fortune 100 CEOs to at-risk teams. So you're in good hands. Bye.
Well, then I'll keep my luck to myself.
Thank you.
Appreciate it. I'll take it.
Good morning, sleepyhead.
I am beat. Scout woke me up twice last night, asking for Wawa. I brought him water and he spiraled his cup across the room. So you're supposed to be resting.
Well, most of my patients would be back at work by now, but Bailey's strong-armed me and taking more time.
It's been less than a week since your procedure.
I am fine. I feel a little pressure when I go up and down the stairs.
We carry you?
Oh, like I sprained my ankle and carried me to the campus health center. No, thank you.
I only dropped you once.
Okay.
I don't hate it, but what is it?
Bacon, egg, cheese, a pancake between two donuts.
It's a sandwich of my favorite breakfast.
Okay, yeah. So you just kind of just. They'll fix those. Okay.
Well, Jeannie brings potato salad to family picnics at a cooler like this.
Well, this one's for precious cargo. Katie Ramsey's waited 6 months for this, Hart.
I will tell Aunt Jeannie that she don't think a potato salad is precious.
I won't tell our patient that you compared Hart to potato salad.
Fair enough. Okay.
Shindiku? I missed you. Jackie said that you had already checked on.
Oh, yeah, I got an early start on rounds today. Jackie's doing well.
Yeah.
So now I'm picking up a heart for a transplant patient.
It's impressive. I'm actually glad I ran into you. We've been here so long. It's kind of weird not to with you.
She seems nice. Yeah, I hope to save her daughter. Doesn't seem like that's why.
Hey, Amelia.
Hey, how's Joe? Not answering my text about lowering my rent bill. Nobody's with that one. That wasn't for me.
Marley Frank, 37, jumped off a 15-foot high bridge in the shallow water. No LLC, complains of neck and back pain, vital stable.
Oh, it's a freaking freezing.
Hello, Marley. I'm Dr. Lincoln. This is Dr. Shepard and Dr. Hell. We're here to help. Did you need to ask? Did you hurt yourself on purpose? We can find somebody for you to talk to.
No, it wasn't that kind of jump, I swear. Over here. Are you a runaway bride? Divorcee. Just finalized it. I'm having a divorce party. They were getting my good riddance, Sarah. I was tossing my ring into Lake Union and I remember how expensive it was.
We tried to stop her and we didn't make it in time. We had a few salvage rate mimosas.
I can make more. They were my bridal party. Now I'm divorce party.
Okay, let's go to channel 3.
You take them away from no alcohol and no hospital. This way.
Then what happened to the case you mentioned last week?
The patient's thigh scan graft worked because it was thicker and stronger.
Are you talking about the thigh scan or his new penis?
You know it's both.
Are we interrupting?
Oh no, Dr. Marsh, please meet my former student, Dr. Evan Moore, and a lovely wife, Professor Tasha Lawson.
Hi. Nice to meet you, urologist.
Oh, leader in penile reconstruction.
She thinks she taught me everything I know.
Child, please, you couldn't have cared less about a penis before you met me, and you know it.
She's not wrong. Tasha, Evan, good to see you again. Good to see you. See you too. I see you already have a general surgeon on the case.
Tasha's case is complicated. She needs a real team. On top of her bile ducts being scarred because of the primary sclerosing cholangitis, she has situs versus.
I thought my sinuses were okay.
They are, babe. We're talking about your abdominal organs being reversed. Don't let her confusion fool you. She's a poli-sci professor and the smartest person I know.
We might be looking at hepatic encephalopathy.
That's why she needs a new liver.
I need a new liver.
Yeah, baby. That's why we're here. Your liver's failing because it's not draining properly.
But what about my sinuses?
They're okay, T. We're grateful Dr. Fox got us listed here and the liver's finally become available. The Portland hospitals are giving us the runaround.
You're with the best now, Tasha.
They wanted like Tasha's consent to have their records sent over.
I already got them. But we've had issues with hospitals losing things. Dr. Fox always said, but we have to take care of ourselves because no one else cares as much.
Okay, let's get started then.
Okay, I'll see you soon.
Thank you.
Richard, where are you going?
Marsh and Gray, they can handle this.
Evan is expecting you.
I can go. He clearly doesn't want to work with me.
Well, I know Meredith prefers to keep her cases close to the vest.
Work with the rest.
Stop, everybody, just stop. Do you know what happened to Evan and Tasha before they came here with us? They were rejected by not one, but two hospitals that were thrown by the situs inversus. And when Evan pushed on them, they questioned her medical credentials. They said whatever they could to make her feel lesser, make her feel small, to make her go away. I promised them top-notch doctors. I promised them A-plus care. Make me rescind those promises, and you know what will happen. Put it aside.
Okay, shall we go look at the things?
Let's get you back in the field, huh?
Yeah, I'd rather get out, even near the hospital.
Well, that woman in the elevator could probably show you around.
Her daughter's my patient.
Not forever.
Yeah, well, we already went out once.
And they didn't buy it.
I think once is kind of my max right now. You ever been divorced?
No.
Okay, well, when the date finds out I'm divorced, the conversation shifts. Like, she's trying to figure out why my ex left, so she can decide whether to cut and run.
Sounds like you just haven't met the right woman.
Maybe this is my life now.
If you want it to be. But years ago, I dated was divorced, and I had to wait a minute for her to be ready for me, but it was worth it.
You ever wonder what happened to her?
She is at our house running an intern retreat.
Hey, can you not stab me? Or will I send you a picture of a toothbrush? Trying to send something back. Wow, you two are terrible at sexting. Don't care. I'll get the real thing after she comes back after breaking up with her boyfriend.
She walked right by me. Didn't even say hi.
Bailey? Miller. She owes someone an apology. Do a wagging, wondering why?
Is this where the caffeine is?
Hey, good morning to you too. Oh, crap. I'm sorry.
It's okay. I accept your apology. Let's forget about it and move forward.
Does she know what she did? Sorry I asked.
Even you can say it.
What do you have outside? Not us.
Hey, let's go, everyone. All right, come on in. Take a seat. Any seat.
But don't get comfortable. Today isn't about being stuck behind a desk writing progress notes.
Is it about working with patients?
Or improving technical skills?
Yes, and yes, today has been designed by Danny and myself to help you become better surgeons.
Why don't we start with an icebreaker to get to know each other?
Well, we know each other pretty well. Can we skip that part?
No, you cannot.
We're gonna break into pairs. So turn to a person sitting next to you and let's.
We could count off ones and twos so we can mingle more.
Yes, that's an excellent idea. Let's start.
These scans are from 3 months ago. She has some bleeding in the common bile duct. But the common hepatic vein should be long enough to do a proper anastomosis.
Sure.
Previous stent is in place. We can transplant the liver at 90 degrees with the right lobe up to accommodate the situs inversus. We're going to operate together. You're going to have to speak to me eventually.
Hey, sorry, excuse me. So Valley Green Hospital sent images of the donor liver.
Any strictures or anomalies that would prevent us from grafting the liver at 180 degrees horizontally?
I just said we should transplant at 90 degrees. So we need to discuss it.
I didn't think you liked discussing medical procedures with me.
What do you think that I've been doing?
I just came to tell you I'm passing on the liver. Yeah, it's too big. I want to hold out for a better fit for Tasha.
They'll be disappointed, but at least I think it's not getting imaging.
Marley, I'm sorry that we had to cut your wedding dress.
Don't be. I can't believe I paid to have it cleaned and boxed. Why did I think I was gonna wear it again? Let me know if you feel any pain. All I wanted was a clean break. It's such an ugly divorce. And soup spoon. I don't even like soup. Does that mean you don't like spoons? Okay, you're feeling pain at the thoracolumbar junction. I think I feel a step off. It could be a chance fracture. Did she say Freud's fracture? No, chance. Like you took a chance on love and it didn't work out. It's a specific kind of vertebral fracture. It's hard to say. We'll know more once we get some scans. Said you wanted a clean break? Hey, Dr. Gray.
That's Dr. Marsty.
That's what I said.
Sorry about that.
I'm terrible with names and encephalopathy.
Are you gonna get the liver?
So I took a look at the donor scans and I think we should hold out for a better one.
Just a good match. Dr. Fox, let me see the scans too.
Okay, well, in terms of blood work and vital serology, yeah, it could work, but the graft is too big.
We're talking about 3 millimeters. Our reciprocal case reports of successful transplants with bigger grafts.
It's also panic cases where it's caused complications, portal hypertension, the graft function, not being able to close up the abdomen.
There are always risks.
Yeah, I'm a transplant surgeon. It's my job to minimize those risks. The Tasha is stable. We should wait. We have time.
Every day that goes by is another chance for her liver to fail. We could wait weeks for another match. You ain't no transplants? I know my wife. She needs this. Now.
Evan, something's wrong with the phone. Keeps buzzing.
Okay, I'll be right there. You're supposed to do the best. Make it happen. Let me see. Maybe it's just Minya. Her and Bar said get well soon. See? They sent pictures.
That's them?
That's their kids. It's your niece and your nephew.
You've got to try the softest sneaker ever. Hands-free, cozy fit Skechers slip-ins. Sneakers that are as soft and comfy as your favorite slippers. Just step in and go with no bendy.
Typical girl wants to wait.
Hands-free, cozy fit Skechers slip-ins.
Untying the human knot takes teamwork and direct communication.
Adams, your elbow is uncomfortably close to my testicles. Believe me, it doesn't want to be.
Come on.
I'm communicating directly.
And simple world.
See, this is some untangling. Honestly, this is a great exercise. You can do whatever you need, a little brush up on cooperation skills.
Oh, we should be practicing square. No, it's not human knots. Can you turn right? Your other right. Oh, am I right or your right? I can't tell. Oh, I don't know which way to move. Can you turn under my arm? Yeah. No.
Okay, good try. Learning how to laugh at our mistakes is also a part of this. Next, we're going to work on problem solving. So pick a number and find your partner.
It's good.
Oh, thank you.
Spinal fractures just require a brace or a cast, right? Hey, Google.
Sometimes, unfortunately, yours is unstable.
We need to surgically place screws and rods in your spine for support.
That sounds like a lot. Are there other options?
Risking paralysis, unfortunately.
I was 23 when I married Brad. I went straight from living with college friends to moving into his condo. This is the first time I haven't ever had to share a bathroom. I finally have white towels because I don't care that they're not practical. I'm supposed to be living my best life, not worried I'm never gonna walk again.
You've got this, Miles. You'll get anesthesia. Much better than cheap champagne.
It wasn't cheap.
Plus, this guy will be taking care of you.
You still go, right? Don't worry. I just got divorced.
We're going thinking for you.
We need to prep her for the OR.
I will let you know when she's done.
Okay. Oh, we'll be here the whole time. Don't be scared. Oh, think about how you got the dog and Brad didn't.
The scares aren't done?
Almost.
Then why'd you page me?
Because we're working together. I apologize to you. I told you I hated lying to you. Catherine was my patient. What did you expect me to do?
I expected you to tell me.
And break every oath I've ever taken?
It hasn't stopped you before.
Hey, Jugo's picking up the liver since he's already on his way for the heart. I'm booking as an OR.
I thought it was too big.
I can make it work. Her encephalopathy is only going to get worse if we wait, so we're going to do it. Scans are in new labs too. Let's take a look. Okay, the tray is draining. That still seems to be working well. LFTs are elevated, but
Not high enough to cause augmentation. What if it isn't encephalopathy? What if it's a stroke?
if it's acute, we shouldn't do the transplant. We should scan her brain.
We should consult Evan first.
We don't need her consent. She's in the scanner already.
Tasha isn't in a position to understand. We should talk to her caregiver.
Will you stop walking out on me?
You stop giving me reasons to walk out.
Remember, the goal is to build the tallest tower that can support a marshmallow on top.
Wait, is this one spaghetti or two? Two. Spoke water on the blueprint, or should I say, the Lucas print? Yeah, we don't think your jokes are funny like Molly does.
We should have drawn a plan.
Almost as tall as theirs.
And they're building faster because they have a plan.
Okay, well, here's the plan. Why don't you stop complaining and stick more of these things together?
Okay, this is too wobbly.
It's made of spaghetti. Okay, time's almost up. You might want to stop debating.
Results in conflict is also obvious.
Figure it out yourselves.
15 seconds. Okay, we need to figure out where to put the last marshmallow.
You just put this. Yeah, like,
I haven't. Should have seen that coming.
what's that supposed to mean?
It wasn't secure.
So after we built this together, it's not just my fault.
Right, it's never your fault. Are you done? Was it done?
Okay, we have a winner. Good job, gents, and good teamwork too.
I texted Marsh to let him know we're on our way back. You ever consider using a professional matchmaker? I will be quiet. Whoa, pull over, pull over.
My daddy is.
Try again.
My daddy is the one skated off the road and it crushed him. And I told him about it for the way, but he looks so bad.
We get up. We gotta be quick. We gotta get my ice.
The doctors. Thank you. We're doing your daughter, right? We do want to stay over here. 5 so far, no problems until then. I'm here. They've been our doctors. They've been in the garage.
I'm Dr. Ndugu. This is Dr. Wally. This chest was crushed. Multiple contusions. He's on top. He's running through his lung or his airway. How long until the paramedics get here?
Just said that they're on their way. You're not leaving, are you?
You got patients waiting for life-saving orders. The doctor can pull a few hours. Delivering the lung. Okay, all right. Let's stabilize his neck, check the leg, and go from there. Okay. Yes, you. Nice and tight. The tourniquet is hard. Bleeding stopped. When's the ambulance getting here? Did you call 911 again? His pulse is getting drained. Do you see any more sources of bleeding?
It's a JVD.
Yeah, tap him out.
Why aren't you stopping him?
We have no supplies.
Doing all we can do. Now we have to just wait for the paramedics.
So 5 to 10 minutes out.
He lost pulses. Starting CPR.
Dad. Oh. No.
Breathe.
Hey. Hey. I reviewed your most recent labs. Everything looks normal.
Any pain or nausea? I feel exactly the same way I did when you asked 2 weeks ago. Lord, okay, no pain, no nausea. Happy now? Where's the rest of your team?
We're dividing and conquering. Nick is studying the door liver.
Richard? You can't be mad at me.
He's upset because I was keeping your secret.
You know, Evan's first ever surgery was on my service. We were doing a hernia repair, and I cut the glass. It took me a moment to notice. We repaired it, but later on I found out she saw it all happen. She didn't say anything. She was worried that I would be mad. That's when I taught her to speak up, call people out, even me. She seems pretty comfortable with you now. Maybe too comfortable. She's like family. When you nurture family, when you train family, the lines become blurred, especially when they use the skills you taught them against you. It hits harder. That means it takes longer to get over. All right, get your team together.
Even on my antidepressants, I wasn't making enough progress. And still hiding my depression. I wanted more for myself. So my doctor recommended Rexulti.
When taken with an antidepressant, Rexulti was proven to significantly reduce depression symptoms more than ever.
It could provide a boost. Adding on helped me move forward.
Elderly people with dementia-related psychosis have increased risk of death or stroke. Antidepressants may increase suicidal thoughts and actions and worsen depression in children and young adults. Call your healthcare provider right away to report new or sudden changes in mood, behavior, thoughts, or feelings, or if you develop suicidal thoughts or actions. Report fever, stiff muscles, and confusion, which can be life-threatening, or uncontrolled muscle movements, which may be permanent. High blood sugar can lead to coma or death. Weight gain, increased cholesterol, unusual urges, dizziness on standing, falls, seizures, trouble swallowing, or sleepiness may occur.
Could a boost help you build on your progress?
Ask your doctor about adding Rexulti.
Selectly consult. Don't judge me. I know I should be taking time off, but it's how I cope.
You really are Catherine's protege.
When I was a resident, they called me Kid. Like we were Kit Kat. Not that we'd ever call her Cat to her face. Tasha's scan still undone yet?
Dr. Gray didn't find you?
No. Is there a problem?
Tasha's tests aren't adding up. We're concerned that she's had a stroke. Dr. Gray wants another MRI.
No. Tasha's already been through hundreds of tests. We're not doing that. Absolutely not. I'm sorry. She's been managing her PSC just fine for 12 years. But lately, I'm scared for her.
I don't blame you.
2 years ago, she was accepting the Marble Prize for Distinguished Faculty, publishing her third book, doing political commentary for the local NPR station. She's deteriorating before my very eyes. I'd do anything to save her. Anything.
All right, no displaced bone fragments or swelling.
No need for decompression. Let's move on to fixation.
It's the first screw.
Now her vertebrae will be bonded forever.
Better than being paralyzed.
She'll also have scar tissue and less flexibility. Some unions are just not meant to be permanent. So I'm never getting married. I mean, look at what you, a lot of people have avoided. Think it's best to say no, no matter how many proposals or rings are involved. You spelled your notes to Wilson back then. She had to talk to someone.
You?
Schmidt.
Yeah, I recommend more work, less chat.
Here, finally.
Swap out with you.
What's going on?
I got blood trauma to the left chest. No problem with this pulse. Let's try decompressing it.
Here's the needle.
Okay, boy. You can get that on there. All right.
No rush of air. No pulse. Still has JVD stethoscope.
Yeah.
He's gonna be okay. Tell me he's gonna be okay.
I think we should open him right here.
Open it.
Chest injuries have caused blood to fill the sac around his heart. That pressure is keeping his heart from pumping properly. The ER will put open the sac to relieve the pressure.
Do you want to do that here?
You won't make it to the hospital. Carry that is moments away from death, but if you do this procedure right here, right now, we just need to move fast.
You really think that this will work?
We'll give him a chance. If they take him, his chances are zero.
Okay, do it.
Excuse me.
Lunges might be my favorite exercise. When we're facing a challenge, this can be a helpful tool to remind ourselves how well equipped we are to handle tough situations. So, who wants to start?
Someone volunteer before they're voluntold.
I was struggling to connect to a gunshot wound patient, but now that I've experienced it myself, I think maybe I'll be able to help more.
Do a shot.
Grace.
Quan and I talked a med student off the ledge. It's a good reminder that you can save lives both in and out of the OR.
This ledge is metaphorical or
Hospital roof.
Yeah, I'm actually feeling pretty great. But it's nice to have a moment to reflect.
I don't want to do this.
Listen, this is a safe space if you have an aversion to public speaking.
I just don't want to put a positive spin on terrible things. We lost a classmate.
Oh my God.
She's still alive. She's still alive.
She dropped out of the program, and everybody's acting like nothing has changed, and everything has changed.
No, Millen, that's not true.
We're playing games. I mean, these two are making out all over the place. Blue is texting his ex or his girlfriend or whatever she is, and you're only doing this to protect yourself in case another one of us flames out or kills someone in the OR. What's the point in team bonding if we don't have a team? Our team is broken. I'm so
All right, almost there. Help me retract the chest. When we get through, I'll release the pressure around the heart.
Wait, what is that? What are you doing?
We're opening the sac around his heart to get it pumping again.
Oh my God.
You might want to look away. Make an incision on the pericardium. All right, done. See a small hole in the heart? Give me a suture.
It's like a suture. Are you sure you know what you're doing?
I'm the chief of cardiac thoracic surgery at Grace Lawn. That means yes. Just a quick figure of 8 stitch. All right. One cup for me. Bleeding stopped. Start cardiac massage. Yep, BP's coming up.
Does that mean you did it? Please say you did it.
Got a rhythm. We did it. Where is T's liver?
It got delayed.
What's taking so damn long?
Doctors transporting it stopped to save a life on the side of the road.
You know I don't care about anyone else right
You're
now.
getting mad is not going to make it get there any faster.
Dugo says the liver should be here within 30 minutes.
I stand corrected.
God, it's actually happening?
It is.
Thank you.
I told you it would. You gotta learn to trust.
I know. Would you mind if I watch from the gallery? I just want to see the first incision so I know it's actually going to happen.
I mean, it's not typically how we, fine with me. Absolutely.
Thank you.
Sure.
There's a light that's always on, there's always love. Back where I am, what I do.
How's she doing? She's fine. Okay, you want to yell at somebody? Yell at me. Come on. Come on. I know you're still angry with me.
I never said that.
You don't think I can see the anger, the hurt, frustration. That's why I scheduled this retreat. I thought we could have a day away from the hospital, polish up on some skills, have some fun.
cook a meal. Maybe too soon, but I had to do something. Because I'm feeling all of that too. You are right. Your team is broken. I wanna help fix that. Do you?
This way you are.
This is the patient we called in for Beckman. I'll get this delivered to Marshall Zawar and then print Ms. Ramsey. Great work today. I'll be sure to tell Alma when I see him. Thank you. Ever do anything like that before? Oh,
Are you sure you can't stay? We planned a few more activities.
listen, your interns have way more than I'm going to handle.
What about all those CEOs you helped?
They're psychologists who specialize in workplace stress or trauma. I go one of them. Good luck.
Silver lining, the traffic should be light.
Thank you for hosting the retreat. Your home is lovely.
The bagels were good. Yeah, no, I've never done the human knot before. And also, honestly, what Quan said.
The bagels were fine. Go home.
I thought we were going to make a meal together.
Yes. Yes, we are. It's not optional.
I scanned Tasha's brain.
Meredith.
Hear me out. Her brain is atrophied. The confusion, the memory loss, the disorientation. I think it's dementia.
I don't need to see it because I have these. After speaking with Evan, I had some questions. So I had Tasha's full medical records faxed to me from Portland. She was diagnosed with Alzheimer's 2 years ago. That's probably why the hospital's transplant committee rejected her. Evan was mentioning Tasha's recent accomplishments, the awards, the books, the public recognition. It made me think of your mother.
Do you think Catherine knows about this?
You think she doesn't?
Swish.
That's really good, he said, beaming round at them. Ron pulled out his own wand. The crowd flew suddenly out of the troll's hand. Super fast. There was a blinding flash of red light.
Harry Potter, the full cast audio. System on over.
Oh, I'm pissed at Quan's pile of onions. We don't need that many.
The recipe said 2, so I cut 2.
I'll take those. Use them for the chili.
I'll wash it. I'll dry. If you want to visit her, I have airline miles. It might not be enough. You can have her. Oh. I was trying to plan a visit, but she said she needs space. Sorry. Surgery worked. We were able to fuse your spine and stabilize your fracture. How long until I can walk?
PT starts tomorrow. It might be painful, but it's good for you.
Sound like my friend is telling me to get back in the dating pool. Sometimes you just gotta dive in, you know? Right, sorry.
Guess what the Seattle Fire Department found?
Oh my God, is that food? We got a box at the hospital gift shop.
It's ready to sell. Then Calvo.
I'm sorry for your divorce.
Just for the best.
Yeah, no, I don't doubt that. You were married. I'm sure at some point you loved him and he loved you. So can't more that boss.
She was an ass from the start, right?
I lost the name.
You split the check on your first date at that sandwich place.
He never remembered your birthday. He texted me the day of asking for gift ideas. Under $50.
She wore sandals at my wedding.
You don't need them. We're your besties and your soulmate.
We'll trade off taking care of you. I'm this week. Get ready to watch a lot of Housewives.
All right. Check her labs and write her bus stop notes.
And when you're ready, Caroline's jewelry downtown pays good prices.
I always wondered what happened to those rings.
Two of the jewelers let me return it. The other guy was a jerk.
Well, thank goodness for Jeremiah. Hey, for what it's worth, I thought what you said was nice.
A friend of mine promised me that if I took time to grieve a broken relationship, it'd eventually be okay and eventually be better.
Well, sounds like a good friend.
Would you watch one of the sports now?
Yeah, everything okay?
Yeah.
Hey. Jackie just fell asleep. Does she need a procedure?
No, I was actually looking for you.
Do I need a procedure?
No, I'm about to transplant that heart I mentioned. I wanted to ask if maybe you'd like to have dinner sometime.
You know, if this were a few months ago, I would have loved that. But Jackie knows now, and that just creates a set of expectations I'm not sure you're ready for.
Yeah, I respect that. Well, if you change your mind, you know where to find me.
So,
Catherine,
aren't you two supposed to be in an OR? We had a few issues to work out first.
like why you lied.
I told you I didn't want you to worry.
This is not about the cancer. It's bad enough. Now you're implicating Gray and me in God knows what? Fraud? Falsifying medical records?
What are you talking about? Tasha's Alzheimer's. Or what?
Tasha has Alzheimer's. Evan left it off the electronic records she gave us.
No. She had me vouch for Tasha to the transplant committee. If they had known, they would have made a very different decision. Evan played all of us.
Well, she learned from the best.
Where is she now?